Hello and welcome to this edition of EC3 HOSA Medical Moments. We've been bringing you a lot of information from the Lincoln Trail Health Department, the district that oversees us, and joining us today is Public Information Officer Terry Bergen. Tell us a little bit about what's going on right now with the District Health Department.
Well, if you want to talk more about the cases that we're seeing and such, as of yesterday, and we left a little bit early yesterday because of voting, we're up to 301 cases. So we went a little bit over 300 yesterday, and at that time, 132 of those were in Hardin, 15 in LaRue, 47 in Marion, 25 in Meade, 64 in Washington, and 64 in Nelson and 18 in Washington counties.
And really that is a really good number.
Yeah, it's actually, it's really, all things considered, when you look at surrounding counties or even states, the number of cases that they're seeing on a daily basis, this is not that bad, but I also don't want to downplay that even though our numbers are low, that we are safe. I don't want people to feel that way. It is very important that people continue to do and practice those preventive measures that we've been talking about all along.
Right, especially because we are so close to Louisville.
Yes. And
Fort Knox, of course, and Lexington, Bowling Green, those larger cities that have larger numbers. But historically, we've done pretty well. I guess we're doing what we need to do, but we need to continue to do that.
Yes, I do believe that people doing the right thing has played a big part in our numbers being low. We're seeing more cases in the sense that we're testing more, but I also want people to realize too that we are also seeing more people. Testing brings more cases, which means more people are infected, but there's a community spread of COVID-19. It's still in the community. It hasn't gone anywhere. We're going to see increased numbers because it's now community spread, and it's been that way all along, and the increased testing is exposing that. Summer is here. It's great outside. The temperatures are fantastic. People want to get in their pools, but you still have to keep in mind and practice that physical distancing with people that you don't know, wearing those face masks when you're out in public, washing your hands for 20 seconds or longer, or using hand sanitizer when you don't have it, when you don't have the ability to wash your hands.
Right, and still cleaning those surfaces and sanitizing those.
Frequently touched surfaces, those light switch, those cabinet handles, doorknobs, computer keyboards, all those you need to continue to clean.
And there's, we've talked before about the state website in terms of this, and your website too. There's a lot of information that's available on those websites, correct?
Yes. kycovid19.ky.gov, they update daily with the governor's new information. A lot of good information there. ltdhd.org is the Lincoln Trail District Health Department's website. We link to the governor's page as well, but we also provide local data. And Gina, I don't know if I told you this, but we have put up a new dashboard on our webpage. So before, you could go to the webpage and you can find the map of the counties, and it will have the number of people who had recovered and the new cases, and then the number of people who were either in hospital or home quarantine. We've extended that information so that at the bottom of that dashboard there are different tabs. So now you can see the most common symptoms. This is just total, not per county. This is just total information. The most common symptoms, basic demographic information broken down by race and age and ethnicity, as well as medical information. Where are most of the cases occurring? Is it the community? Is it congregate settings? We're adding that, not quite there yet. And just really good information that allow people to dig a little bit deeper.
Awesome. Now, you also added, you were trying to survey teenagers, right? Or young people.
Yes, we were. And thanks to you, we had a better turnout, because I think when I talked to you, we had like 13. So it increased to 50, which is really good. I mean, it's better than we thought we were going to get, to be honest. So 50 is great. And so we really want to thank the public for those teenagers and young adults that took the survey, because it helped us out a lot to improve the content of the teen website that we're trying to put together.
Mm-hmm. Now, will you survey again, or just keep it at that model?
Later, maybe. Mm-hmm. We've wrapped up a focus group with a couple of teenagers yesterday to just delve a little bit deeper. What we're going to do next is take the information from the survey, take the information from the focus groups, put all of that together, and then we're going to send it to our the digital marketing firm that we work with that helped design the web page, to make sure that the content aligns to what we found out, to the feedback.
Right. Mm-hmm. One of the elements that has come about from this entire pandemic is contact tracing. Okay, explain what that is. And I know that you all have hired individuals that specifically do that, and then what their role is and what people may expect if a friend of theirs has tested positive.
Okay, well, let me say this before I begin on that. What people may not know is the health departments across the state have done contact tracing for decades and decades. This is just a part of what we would normally do. I think one of the things that I mentioned when all of this COVID-19 started is that we received over 100 communicable disease reports a day. This was before COVID-19. And so that still continues, even though we're trying to get our hands around COVID-19. Those cases had to be followed up. Someone had to call them. We had to notify those individuals for particular diseases that they were a contact or they needed to stay home. That never stopped. What has happened is that COVID-19 has kind of ramped it up. And so the governor has hired additional folks to assist the public health department in that role. And so what happens is, as I mentioned before, you will have individuals who will call you. Now, all of their equipment, the phones that they use, the computers that they use, were purchased by the state. So those phones may have a different area code than a local area code. So if they call you, you may not recognize the number. And if you're like me, you're not going to pick it up. And so what I usually do is I listen for the message, and they will leave you a message to call them back if you have been either one, you are a confirmed case of COVID-19, or you are a close contact of somebody who was a COVID-19 case. Close contact meaning that you were within 6 feet, so 6 feet or less, 10 minutes or more of an individual who came back tested, who has tested positive for COVID-19. They will be reaching out to you. And then at that point, they will provide you, they'll get some general information. So for example, for a positive case, they'll get general information, they'll find out who their contacts are, and then they will provide them with instructions on what they need to do to quarantine safely at home, and that they need to restrict their movements.
Now, with that in mind, are they required to get tested if they've been identified as being in contact with another person?
It depends. It really does depend. So the guidance has been thus far that if you have if you are a family member and who lives with somebody who has been confirmed case and you're not, so what the guidance is that that person and you really should be separated in your own home so that you don't contract COVID-19. You just continue to monitor your symptoms. Those symptoms are sent to the health department every day to make sure that there's no change, that type of thing. And so you look for the cough, you look for the tiredness, you look for the fever, you look for the shortness of breath, those type of things. If they occur over 14 days, because that's the quarantine period right now, then you can go get tested. Now, let me say this. You can go get tested anyway. You're not limited. Just because we say you don't have to have a test, you can still go get a test done, but it's not required that you get a test. We just monitor you over the 14 days. If you develop symptoms, then a lot of times it's assumed that you have the COVID-19 because you come in contact with your family member who you live with. So really, the test is assumed that you have it, but you can still go get tested. Yeah.
Mm-hmm. Recently, a family member of mine was working at a new location in Louisville, and a worker that was training her noticed a cough.
Okay.
So they sent that person home.
Okay.
She had to get tested.
Yeah.
It came back negative. So it's literally like people are kind of being the COVID-19 police, I guess.
Yeah, because everybody's a little nervous, and I can understand that. You know, people have seasonal allergies, you know, those types of things that can get confused. If you have a regular cold even, that can get confused with the COVID-19 symptoms, because COVID-19 symptoms mimic so many other common illnesses. I mean, look at flu, two things I mean, the seasonal allergies, the cold, just as I mentioned a few minutes ago. So you just don't know. You don't know for sure until you go get tested. So just because a person has a cold does not mean that they have COVID-19. You need to consider all those other factors. Have they come in close contact with someone who's confirmed case, or a contact of someone who was a contact of someone who was a confirmed case? You know, just things to consider. And also, you know, and that's kind of hard to do because as I mentioned before, it is in the community, it is spread, and there are some folks who just won't have any symptoms at all. So all of that needs to go into your thinking. However, if you are in doubt, always seek a test. You know, if you're concerned, call your provider, get tested.
And there are numerous opportunities to do testing.
Yes, there's actually quite a few places within our 6 counties. I would recommend that people go to the kycovid19.ky.gov site. There is, at the very top, there's a drop-down button. You can plug in the county that you would like, and it will tell you exactly where the locations are where you can go get tested in the county, in your specific county.
Well, we've been in the process of opening up things and expanding in terms of how many people can be in restaurants and to do this and that. I'm assuming that with this new surge that we have turned up more cases.
We looked at the data from Memorial Day till about the first week in June, and we saw about a 36% increase in cases throughout Lincoln Trail District Health Department. We'll look at that data again to see in a couple of weeks. We're monitoring it weekly anyway, but you know, you have to monitor it over time. It's not like today we see an increase in cases. Well, what does that look like over a week or 2 weeks or 3 weeks? So we'll look at that again very shortly to see if we're still on a rise.
Right, and of course, you know, we've had recent situations where with public protests, you know, peaceful protests and stuff, a number of people are out, they're standing for long periods of time and things, and so when that window, and they continue to do that, some of those numbers are definitely going to go up.
Yes.
I think it's just common sense.
It is. You know, you put yourself at greater risk the longer you interact with someone. If, again, I'm less than 6 feet apart, more than 10 minutes, the longer you're standing and you're talking to someone, the greater your chances are that you're at greater risk for being exposed to and potentially contracting COVID-19. I also want to say too, Gina, that the CDC has just put out some new guidance related to when you decide to go out, some things you should consider, and when you decide to go out to specific places like restaurants, gyms, nail salons, local cookouts. That guidance is on the CDC website. It is also on our page, the LTDHD page, under the specific guidance for certain audiences category. Click on that, and it can give you some steps that you can take before going out into public.
Okay, that's great, because we're getting ready to go on vacation.
That's on there.
Right, and so we've got little ones, and So knowing those things really help prepare us as well and things. Have there been any deaths since the last time? I think we've had a couple of deaths in our district since the last time, so can you tell us about?
We're up to 9 now. There's 5 in Hardin, the 2 in Meade, 1 in LaRue, 1 in Nelson. And I think since our last conversation, the additions are in Hardin and LaRue County.
Yeah. With one thing that I have heard is that younger numbers of positive cases, younger people are testing more with positive diagnosis. Is that just because they're out more, or we're just paying better attention to it?
Well, our average age in Lincoln Trail right now, current data, because this changes, is in the 40s. That's our average age. But when you look across the United States, it seems to be that people between the ages of 20 and 30 are testing more. That may be because now they're testing asymptomatic folks. At the onset, we actually thought more that the younger individuals who suffered less from the COVID-19, that was our thinking at the time, because we know what we know at the time. And as you know, the information with COVID changes constantly. That because they're testing more, they're picking up more of these younger folks who may be asymptomatic, and that may be a reason for the increase. Or it may just be the nature of COVID-19 and what's going on with that particular disease.
Well, and some of the discussion has been that COVID has died down, but we're just seeing a little bit of an uptick. But in actuality, that may not be true.
No, the news is flooded with warnings from the NIH director, Dr. Fauci, on that we may be reopening too soon. Summer's here, so individuals and people want to get out in that, and it's so nice out. But you can do that, you can get out and still have things on hand. Keep that mask on hand, have that hand sanitizer on hand, tissues, so that if you cough into it, and then you can just, toss it in the garbage. Physical distancing, these are the things that are not that hard to do, but they work. And so we really encourage individuals to continue to take those steps. I'm not sure about you, but when I go out in public, I'm seeing more and more individuals not wearing their masks, not doing the physical distancing. It is not over. It's still very present, and we still need people to continue to do the right thing.
Yeah, I remarked that sometimes I feel like I'm the only one in a store wearing a mask, other than the employees, because the employees are doing their job really well.
Yeah.
When you said that there are guidelines available for those individuals where you go to a restaurant or such, how does your department work with individual businesses and organizations in that regard?
Well, what has been happening in the past is that, initially the governor had asked folks to send plans for reopening to their department. Not all were required, but they took that to kind of help build guidance for what they wanted businesses to do. There are minimum requirements that the businesses have to meet in order to reopen. For example, universal masking is one. Having hand washing and having the availability for people to wash their hands and that type of things is another. So our department has played a role, has kind of had 2 roles. One, in enforcement, because we still get calls on that complaint line for people who are complaining about businesses that are not complying. And 2, some businesses have reached out to us to kind of have them look at their plans to see if what they're doing is appropriate. So our environmental director has had a role in that. Yeah.
The idea of plexiglass and that one-to-one contact, I think that most of the businesses that I've been in terms of those one-to-one, face-to-face contacts, I've seen those and things. And of course, now we're getting to the point where they are opening up state parks and national parks, and people doing a lot more traveling out of state. I guess just follow those good skills that you've already mentioned, right?
Yes. It is, and those are the things that we know that it works. What I love about it is that it's not hard to do. It's very simple, and if you do it, it will help. We know it has been proven that it will help reduce the spread of COVID, of the virus, yeah.
For the audience at home, for those individuals that don't want to wear a mask, again, tell them why that is important and why that mask is a barrier of some kind. A barrier of any kind is better than nothing.
You've just hit on it. A barrier of some kind serves a purpose in to help blocking that virus from spreading out. You put the mask on. There was a recent demonstration done by the New England Journal of Medicine. And they took a gentleman with a mask on and without a mask. With the mask on, there was hardly any, because they were able to see his respiratory droplets as he spoke under the light some type of way. Don't ask me to explain it, but it exposed them. With the mask on, hardly any were visible. Without the mask, even talking low, you could see the flecks of the respiratory droplets being spread. Having that mask on helps to block that. It really does. It serves a purpose. If you have COVID-19 and don't know it, then you are protecting others from yourself and vice versa. You have to couple that, though, with the physical distancing. The 6 feet or more apart is just like a double whammy. It helps to provide that additional protection. And of course, washing your hands. Don't touch your mask when you have it on, because if you touch a surface and you touch your eyes or your mouth or your nose, you can potentially be infected that way, even though it's at a lower rate of infection. But still, that mask is very important.
Do we have any other diseases or things that are popping up during this time that you all have noticed an uptick in?
Well, you know, it's interesting. We were just sitting in on a webinar, a local webinar a couple of days ago, and what they've, KIPRIC data, and I hate I even said KIPRIC because now I'm just going to leave it at KIPRIC because I cannot remember what the acronym stands for, but they are kind of like, they provide data for the state. And so what they've noticed from emergency department visits is that because of COVID-19, a lot of those visits have decreased, right? What they have seen an uptick in is overdoses.
Wow.
Those have continued, yeah. So, and if I'm not mistaken, you know, this is information from across the state of Kentucky. So people are not seeking out so much the normal, you know, if you have COVID-19, of course, go get tested through your health care provider, not so much the emergency room. But yeah, we've seen those upticks in the overdoses.
So probably because that person is suffering from pain of some kind, and they're trying to medicate themselves out of the pain rather than going to a doctor's office or such. Inadvertently, they could be overdosing. You
know, COVID-19 has kind of revealed a lot of different things, don't you think? It has required us to isolate,
right?
You know, and you know, it has required us to, if you don't have support systems in place and you're isolating, that could feed into that. There's a lot of different things that could feed into why we're seeing more so an uptick in the overdoses and the within Kentucky. But one of the things that I am hearing from our mental health folks is the isolation it may play a part in that.
We are hoping to get school started soon.
Yes.
What role does the health department play in helping school districts?
Well, one of the things that will happen is that our environmental director and our community services director will be, for those schools that want us to review their plans, we'll be reviewing their plans to provide additional guidance. Now the school, of course, writes the plan, and then they receive input from us, the health department, and we can add what that looks like from an environmental perspective, think cleaning and that type of stuff, and the physical distancing piece, and then there's the health piece that we also will couple or blend in with their existing plans.
Do you feel that in this area, I guess we are doing a pretty good job of maintaining some of the things that we've been asked to do. Has there been any cases from our area nursing homes or our detention centers by chance? Have you seen anything in that regard?
Well, our nursing homes and our detention centers have done a really, really good job. Awesome. The majority of our cases, pretty much all of them, have come from household contact, so you have a family member, or in the community. That's where our cases come from. Yeah, not so much our long-term care or congregate setting, the jail, detention centers.
With the state, does the state make the decision and pass it down to you in terms of your role, your department's role? Like, is there a statewide health department that oversees the information that you all disseminate?
Well, there is the Kentucky Department of Public Health that provides some guidance. They try to keep us up to date on what's happening throughout the state. But the actual day-to-day operations, there are specific regulations and that we have to follow. That's written in the Kentucky regulatory standard, the KRS. I think that is okay. That applies to us, and yes, we implement those from the state level, but we seek them more as providing, looking to them more to provide an update on guidance and things that we need. We take that guidance and then we implement it here at the local. It may be very broad, it may be very detailed depending on the situation.
Before we go, anything that we haven't covered that you want to touch base on or share with our audience?
Well, I just want to reiterate, COVID-19 is still here. We really encourage people to continue to wear their masks. The physical distancing, washing their hands is still very important.
All right, awesome. Well, thank you, Terry, and thank you for all the work. Tell everyone at your department that we love them, we appreciate them. We want everybody to stay safe. Keep your distance, stay healthy, and just appreciate. You guys are like the other heroes. You know, we got a lot of heroes in the area.
Well, thank you.
So you guys are really doing a great job and making sure that we are doing, you know, like we said, we're doing really well. So keep it up, keep going. And thanks again for joining us today.
Thank you.
And thank you for watching us at home. And again, you can reach out to the Lincoln Trail District Health Department via their website and also the state government's website. There's always great information there. And you can phone as well. So thank you for joining us and have a great summer.